Good evening, everyone, and welcome. My name is Dr. Kim Hecht, and I'm the Medical Director of Inpatient and Ambulatory Care Services here at the Susan Samueli Integrative Health Institute. Thank you so much for joining us during our free community lecture, Integrative Insider Live. Our main clinic has moved to UCI campus, and we are so excited about this brand new space. It was designed to best empower you on your whole person health journey. We also offer integrative services at other UCI health sites, including Newport Beach near Fashion Island, Pacific Breast and Oncology Hematology at the Pacific Medical Plaza in Costa Mesa, Yorba Linda, and Laguna Hills. Now, before we start, there are a few Zoom housekeeping items. We are recording this session. After the session, we will post this webinar on our YouTube channel. In this particular webinar, although we do want to hear from everyone, you will all remain muted and have the video off. Please use the Q&A feature at the bottom of your screen for any questions or to communicate with us during this session. After the presentation, I will moderate a Q&A session. Now on to our main event. Today, we have the pleasure of hearing from Michelle Luhan on diabetes, diet, and disease prevention. Michelle is a board-certified registered dietitian with the American Dietetic Association. She's a certified dietitian and nutritionist and member of the Academy of Nutrition and Dietetics. As a registered dietitian with a master's degree in clinical nutrition and food science from New York University, Michelle is schooled in evidence-based medicine and integrative health. With over 25 years in private practice, Michelle has a trusted referral base from doctors, healthcare providers, corporations, and clients. And beyond her professionalism and applied experience, what people love most about working with her is her practical, easy to follow guidance and results. Michelle, take it away.
Thank you, Dr. Hecht, for that lovely introduction. And I'm honored to be participating here today. As mentioned, this talk is on diabetes, diet, and disease prevention. Before I jump in, I just want to say that, as many of us know, diabetes is an increasing health problem in the United States and globally. So we hope we can help you debunk and learn more about how to manage and treat diabetes if you or your family members have it. According to the Center for Disease Control and Prevention, 11% of the United States population, that's 37 million people, have diabetes. And 38% of US adults are pre-diabetic, and that's the precursor for diabetes. And 50%, if you have pre-diabetes, you have a 50% chance of getting diabetes in 5 to 10 years. So it's really, really important that you address your pre-diabetes sooner than later. And sadly, 1 out of 6 adolescents, those are children aged 12 to 18 years of age, now have pre-diabetes. So why does this matter? Well, diabetes was the nation's 8th leading cause of death in 2020. Those with diabetes are twice as likely to have heart disease or a stroke than those without diabetes. I often tell my patients, we don't die from diabetes, we die from diabetic-related complications. And diabetes is the leading cause of kidney failure, non-traumatic lower limb amputations, and blindness among adults. And sadly, the cost of diagnosed diabetes was $327 billion in 2017, and that was a 26% increase from 2012. So post-pandemic, we're looking at probably even more daunting numbers. All right, so what is diabetes? Well, diabetes is when your blood sugar is higher than it should be. And we often refer to 3 different types. Type 1 is—
Michelle? Sorry, your screen isn't sharing.
Oh, okay. Is it sharing now?
I don't see it now.
Oh my goodness, I am so sorry. Okay, let me see what I can do here. Share screen. Here we go. My apologies.
Okay.
How about that?
You're all good. Perfect.
Okay, apologies for that. So yes, there are 3 types of diabetes. Type 1 is when it's basically an autoimmune disease, and it's your immune system attacking and destroying the cells in the pancreas that make insulin. So we see that typically in childhood. It's not very common. It represents about 5 to 10% of diabetic cases. Type 2 is when your body does not produce enough insulin or your body doesn't receive insulin well. And that is usually diagnosed in middle age. It often presents with obesity or when someone's overweight, and it does make up about 90 to 95% of all cases. So we often refer to type 2 diabetes when we speak openly about diabetics. Gestational diabetes is when you're diagnosed with diabetes when you're pregnant, and oftentimes you go in for a glucose test and you're given a big bolus of high sugar, and we see how your body responds. And if you have gestational diabetes, you really want to address it and manage your diet because it can lead to diabetes later on after the pregnancy. Some of the side effects if diabetes gets a little out of control or is not treated, unfortunately, it's heart disease, stroke, nerve damage. We often refer to diabetic neuropathy, foot problems, gum disease, kidney disease, eye disease and blindness, and even sexual and bladder problems. So we really want to manage the diabetes the best we can so that these uncontrollable or controllable symptoms don't present. And I always like to show this picture here of the artery. When we talk about prediabetes, we're talking about a high level of blood sugar that is not quite diabetes, but it's getting close. And you can see this image. You've got the glucose in the blood in a normal artery, normal blood sugar, and then the excessive blood glucose in that artery. And oftentimes, before diabetes present, we start to see something called insulin resistance, and that's when your body, like I said earlier, does not receive the insulin properly the way it should. Or what happens is if your diet is too high in sugar, your pancreas eventually cannot produce enough insulin. And like a car that's sort of being run over time and not fixed, it just starts to go put, and it can no longer produce enough insulin to keep up with the demand of your diet. And I again show this picture because the sugar crystals are not smooth. They actually have like very rough edges. And so when your blood sugars go up, you actually create, it's like a scraping inside your arteries that creates an environment for plaque to build up. So we really don't want to have those high sugars in the blood to begin with. Now, if you're a physician or someone mentioned to you that you're trending towards prediabetes, there are usually 3 markers that we look at. Abdominal fat is one, but typically it's the hemoglobin A1C, which is the HbA1c, that starts to creep up a little bit. This is a really great marker because it shows us your sugar intake patterns over 3 months. So it's also a good way for us to sort of see if our diabetic patients are being compliant and eating properly. Every little event where you are consuming too much sugar and your body is unable to properly process it, if we get these spikes in our blood sugars, it will get recorded in the A1C. So, you could be doing really well with your diet, and then you have a couple days where maybe you snacked on some crackers and some cookies on an empty stomach, and you might get a spike. Well, it will get recorded, and that's what we look at to see, how we can best manage your blood sugars. Fasting blood glucose is the standard fast that you do at the doctor's office, and you can see, we want to keep that level below 100. If you start to creep up to 125, that's oftentimes a sign that you might be trending towards prediabetes. And then the oral glucose tolerance test is just a larger bolus of sugar. And that one is not as common in diagnosing diabetes, but it is done when you are pregnant. So, excuse me. Oops. All right, so how do we prevent diabetes? That's what we really want to talk about. And how do we treat it once we have it? And the number one thing you can do for both of those is lose weight if you're overweight. The fat we put on around our belly often is associated with visceral fat, which causes inflammation. And inflammation is sort of the root of all diseases. So we really want to reduce inflammation in the body, not increase inflammation. You also want to exercise. Exercise is available if you just walk outside, if you're capable of walking, if you belong to a gym, or you can just maybe try to get 30 minutes a day every day, or 60 minutes 3 times a week. Studies have shown that by doing that, you can reduce your risk of diabetes by 25%. Even walking for 10 minutes after a meal can lower your blood sugar by 22%. So anyone taking insulin will notice an incredible improvement in their blood sugars, just by doing a 10-minute walk after a meal. And also, exercise is good for your mood. Study after study shows that it's more effective than antidepressants in managing depression. So, and antidepressants are helpful for some patients, but they can impact your gut biome, and they can have they can actually put some weight on you in some cases. So if you can get out and exercise, it's always our first recommendation. And then the Mediterranean diet. I'm a big fan of the Mediterranean diet. I come from a Mediterranean background, and fortunately, study after study have been showing that the Mediterranean diet, not just in preventing cardiac events and lowering cardiac risk factors, so factors that can prevent you or encourage you from getting heart disease, but now we're seeing the Mediterranean diet really helping with lowering blood sugars. And a lot of that has to do with the fact that the diet is very high in fiber. It's mostly plant-based, and it has a lot of minerals and nutrients that our body needs. And then lastly, if your physician recommends a medication, then the more common medications prescribed are metformin, insulin if you're insulin dependent, and more recently Ozempic, which helps with sort of curbing your appetite and helping you to feel full sooner. So that's really helpful with weight loss, and it's now becoming a weight loss drug. But like anything, you always want to work with your physician before taking these medications. Okay, talking about the Mediterranean diet, just to give you a little background, it was a diet that was developed by Old Ways Preservation and Trust, the Harvard School of Public Health, and the World Health Organization in 1993. 1997, I believe, is when the Luhan heart study came out showing the heart benefits of the Mediterranean diet. And just last month in the British Medical Journal, there was a meta-analysis study that looked at all the 7 different heart healthy diets and compared them to the Mediterranean diet. And the Mediterranean diet was superior in reducing the risk of mortality and non-fatal myocardial infarction, heart attack in people with increased cardiovascular risk. So again, people do not die from diabetes, we die from diabetic related complications. So we really want to always reduce the risk of some of those other potential complications that could lead to heart attacks or heart disease. Sadly, the American or the standard American diet is not as rich in fruits and vegetables and some of the other merits of the Mediterranean diet, which I didn't get into in detail, and I can go back to that, but basically it's more of a plant-based diet with lots of beans and nuts. Actually, I'm going to go back to it because I omitted to discuss this a little bit more. The crux of the diet is exercise, eating together, plant-based foods, more beans, legumes, vegetables, fruits. The grains are coming from whole grains, not from refined or white processed grains. It's not coming from packaged foods. A lot of the fats are mostly from the nuts, from the avocado, from the olive oil. And a lot of these fats actually have anti-inflammatory properties, and they're very high and they're rich in polyphenols and antioxidants. Fish oil is also a healthy fat for the heart and for the blood vessels. So the Mediterranean diet, recommends a lot of fish, maybe 3 to 4 times a week. Very little fat from dairy, very little fat from yogurts. Most of the dairy is like low fat, and if they use cheeses, they're adding it as flavorings, not just chunks of packaged or processed cheese. And meat is consumed sparingly, and sweets as well. So there's not a lot of sugar in here, and there are not a lot of sugary drinks. Occasionally, a glass of wine is recommended with the meal, and obviously lots of water. So we need to just remember this image and try to eat more like the Mediterranean and not like the standard American diet, which unfortunately is becoming more and more prevalent, especially among young adults who are the largest growing in weight group of Americans. We're getting bigger, and food portions have gotten bigger. And as a result, we've gotten bigger. And it's not just the foods, but it's the quality of the foods, the amount of sugars in the foods, the preservatives. There was a time when trans fats were considered good for you. Now we know they're not good for you. They clog your arteries, they cause inflammation. High fructose corn syrup. These are all ingredients that are in packaged foods and processed foods, and they're there for a reason. They help the shelf life of the food, and they also are inexpensive, so they help the profit margins. And we really have to be careful and consume these foods in moderation. I know it's alluring, it's tempting. They do act like a drug in our brain when we eat them, and that's not by accident. So just, even your coffee drinks, a simple cappuccino or an espresso or coffee is now potentially a 600 calorie drink, lots of sugar in it. So, just be careful in consuming less of these foods. Unfortunately, 1 in 5 American children are now obese, and toddlers ages 2 to 5 consume about 58% of their calories from processed foods. Which is really kind of mind-boggling if you think about it. And these little bodies are not designed to break down these foods, and we're starting to see adult onset diseases present in children, like diabetes. So, and to that point, studies have linked processed foods to all types of disease, from autism to Alzheimer's. So we want to reduce the amount of these processed foods. All right, so how do we do that with diet? Well, we can follow a Mediterranean diet. We can try to eat less food, watch our portions, not eat as much processed foods, okay? That's all seems very practical and very obvious, but how do we implement that? And I find that this particular tool that came out of the American Diabetes Association is a very handy tool to present to people. If you imagine your plate, and we want to always plate our food. Just, standing, eating out of a bag or eating out of a packaged container is not ideal. We want to be like the Mediterranean, people, and sit and eat together, have that conviviality, but also make half your plate, I don't care what kind of vegetable it is, lots of color, but make it lots of, vegetable and fiber. A quarter of the plate can have the carbohydrates. So if you want to have bread, or you want to have pasta or quinoa, or a starchy vegetable like a potato or a sweet potato, there's room for that on the plate. Just keep this, proportion, the ratio of quarter carb, half the plate vegetables, and then a quarter of the protein. And by doing so, you'll keep your blood sugar steady, and then you won't put that much of a demand on your pancreas to produce more insulin. And so that's just a very healthy and simple tip for managing, how you eat and how much. Of course, we want to get water in with our meals and not have sodas. Diet sodas have shown not to help with sugar control. So if you can avoid them, I would recommend them. They actually can make you hungrier, and they can alter the gut biome. So, and more recently, there were some studies showing that they can increase your rates of stroke and potential other cardiac events. So we really want to keep our diet clean, and in a perfect world, stick with 1 ingredient foods. So carbohydrate counting is a little more detailed, and it's often used for patients who are starting insulin. So that is, something that most people would not be, required to do. All right, so fiber. A lot of people say, well, what's fiber, and what are the different kinds of fiber, and how does fiber help me? Well, fiber helps basically block the blood sugar, the sugar in your blood from going into your cell. Okay, it does so by, there are two kinds of fiber. There's the soluble and the insoluble. So if you're eating lots of different plant foods, you're going to get a combination of both. You don't have to worry about, oh, I need this much soluble or that much insoluble. But when we eat foods that are high in fiber, we're making that mixture of food a little more complicated, and we're making it harder for the blood sugar to go into the cell. And where's fiber found? It's found in vegetables, in whole grains, in legumes, and in fruits. So once again, lots of plant foods. This is what we're encouraging everybody to eat. And if you are insulin dependent and you're reading labels, and again, we don't want to have a lot of packaged foods, but there are those times when you need to buy something packaged. You can look at the fiber grams and you subtract that from the total carbohydrate grams. And that will give you your net carbohydrate count for that food. And typically diabetics on insulin try to keep their carbs under around between 15 and 30 grams per meal, depending on how much insulin. So once again, fiber is important for the fiber that you're getting from the fruits and vegetables. It's also important for managing the blood sugars, and it can lower cholesterol levels. And it's good for the gut biome. It's a precursor for the good bacteria, often referred to as the probiotic. And you want to aim for 25 to 35 grams a day. So if you like to count your grams, then you can count your fiber. Another important nutrient is water. Hydration for blood sugar control and weight loss. Our bodies are around 70% water. Our brain, our heart, maybe a little higher than that, closer to 80%. So we need water for all of the bodily functions. But we tend to forget that water hydration is also really good for controlling the blood sugar and the weight loss if needed, if we're trying to lose weight. Drinking water is a natural appetite suppressant. A lot of times we think we're hungry and we go to snack when in fact we might just be thirsty. Cold water stimulates your metabolism a little bit because your body has to warm it up for digestion. Water helps remove waste from the body. Without water in our kidneys, we wouldn't have that elimination process. If we're drinking water instead of soda, well, we're saving calories, liquid calories. Same thing for juice. Water is necessary to burn fat. In order for lipolysis, which is the breakdown of fat, you need hydrolysis, you need water for that. It helps with your workouts, for your muscles, it helps your brain to think. A lot of elderly people start to show signs of dementia, when in fact, a lot of times they could just be dehydrated because their brain's not telling them to drink like it would if we were a little bit younger. So how much water? Typically we say half your weight in ounces of water a day. So if you weighed 160 pounds, you'd want to consume 80 ounces, which is about 10 glasses of water. And don't forget, you're getting water from fruits and vegetables and teas and coffees and soup. So it's not hard to achieve. And you also don't want to overhydrate, because then you can run the risk of being hyponatremic. And that's when we start to see, electrolytes go off and people get headaches or they get a little weak. So the right amount is recommended, not too much. All right. Supplements, plants, herbs, there are a lot of products out there on the shelves touting blood sugar management control. So just be careful. Obviously some of the teas like cinnamon tea and coffee, celery, flaxseed, they're going to help lower your blood sugars naturally. Chromium, picolinate, magnesium, berberine, vitamin D3, they've been studied more than some of the other supplements out there. But, vitamin D3, in fact, if you're low, we can see A1C go up. So, and, in every case, you want to discuss this with your doctor or your dietitian and determine what is the right supplement for you. But there are some natural foods out there, which is why it's always better to eat plant foods and keep it natural versus supplements. Time restricted eating is a new way of lowering the blood sugars. It involves eating within a certain window of time. And I just want to say this is not for children. It's not for type 1 diabetics or for anyone with an eating disorder. What's happening here is they found that it's easier for people to restrict the amount of foods and calories they eat if they have a set time period. So this is really kind of replacing a calorie restricted diet. And also we're seeing that when we don't eat for a set number of hours, we give our body some time to just rest and recharge and detox, the cells kind of act better and the body works better. And we're seeing metabolic markers improve. And so weight loss usually tends to be a little more drastic when people go for longer fasts. So like if they decide to go for a 10-hour fast and only eat for 14 hours, 14-hour fast and eat only for 10 hours versus a 16-hour, 8-hour, those are the periods or time periods we see larger weight loss. One thing to keep in mind is that while you are on this sort of eating pattern where you're only eating for a set window of time, you still want to eat healthfully and you still want to make good healthy choices and ideally follow a Mediterranean diet, or if you're vegetarian, plant-based diet with high plant protein foods. And I just want to sort of sum this up by saying a recent study out of the University of California of San Diego showed time-restricted eating, otherwise known as intermittent fasting, as being a helpful way to reduce blood sugars, cholesterol, blood pressure among shift workers. So, we often think of people who work late at night or have irregular work patterns of being a higher risk for some of the metabolic diseases and some of the health parameters we look at, like weight or cholesterol. And not only did they find that intermittent fasting or time-restricted eating was doable, but the firefighters had no loss of energy. They split these firefighters over 12 weeks into 2 groups, and the group that followed a tighter time period, 8 hours, it was 10 hours of eating versus the standard 14 hours, they actually had an improvement in their blood sugars and their cholesterol, blood pressure, all those parameters. And the little added bonus was that group also ended up consuming 50% less alcohol. So we're going to probably see more studies being done looking at time-restricted eating. And in sum, I just want to say that myself and my colleagues here at the Susan Samueli Integrative Health Institute are, happy to help anyone in need of, diet counseling. We are registered dietitians, we're board certified, and we practice medical nutritional therapy, which is covered by Medicare if you're diabetic or if you have kidney disease. And if you don't have Medicare, it's always advisable to, ask your insurance plan if they cover for nutrition counseling. You can also get a referral from your physician. And sadly, only 1% of eligible patients actually see a registered dietitian for diet counseling. And it can be very, very impactful and positive in helping diabetics manage their blood sugars. So with that, I want to thank you and hope to see you and leave you with the last 5 little tips that we went through and takeaways. And hopefully you learned something from today. If nothing else, that diabetes, consists of 3 different types, and maybe now you're a little more aware of the complications. It's not so simple. It's just blood sugar can impact your body in many different ways. Look out for prediabetes, and always first think of diabetic management with diet and lifestyle and exercise and sleep. Stay hydrated, consume lots of fiber, and speak to your doctor or dietitian about perhaps the benefit of time-restricted eating if you're looking to lose weight, reduce inflammation, and ultimately reduce disease. Thank you so much.
Hold on. Thank you, Michelle, for that wonderful presentation. One of the attendees had a question about what time window the San Diego study used, and maybe you can elaborate more on the different hours that are sometimes used in the intermittent fasting again.
Sure. The easiest fast is 12 hours. So sleep for 12, basically you eat within a 12-hour window. The study out of UC San Diego with the firefighters that was out of published in Cell Metabolism, they used 14 hours. So they fasted for 10 hours, and the regular group, the non-intermittent fasting group, just fasted for 14 hours, and then the intermittent group fasted for 10 hours. And they did it for, I believe, 12 weeks. Yes.
Is there one type of recommendation that you generally go with if you do recommend intermittent fasting, or is it really like dependent on the person that you see?
I first try to understand how they currently eat, and if they're a good sleeper and it wouldn't be hard for them to go 12 hours, I ask them if maybe they could go push it a little bit more if they're trying to lose weight, because we have shown that, we haven't shown, but the studies have shown, and anecdotally, people tend to lose more weight when they make that fast a little bit longer. So I would say like a 14-10 or 16-8 if you can do it. It's not every day. It's 5 days of the week and then 2 days off. And on those off days, you don't want to sabotage the work that you did, but and some people do one meal a day, but that's very difficult for most people to follow. And I wouldn't recommend that for everyone.
Thank you. And then Louise, one of our other attendees was talking about, we mentioned the Mediterranean diet, but there's other diets out there that have fiber as well. Mm-hmm. And maybe if you can comment on that and your thoughts of steamed rice versus like steamed potatoes.
Okay, sure. The only reason why I mentioned the Mediterranean diet repeatedly is because it's been studied and compared to other studies with regards to decreasing your total disease risk factors, particularly the heart. And this is a diabetic presentation, and the heart is really, our biggest concern. Any diet that has more plant-based is going to be full of fiber. Now, steamed white rice or white rice versus, what was the question? White rice versus?
Steamed potatoes.
Okay, so you can look at something called a glycemic index, and the glycemic index is going to give you a reading on how foods spike your blood sugars. The higher the number, the higher, the less time, and the higher it's going to spike your blood sugars. But most of us don't just eat white rice alone or steamed potatoes alone. We eat that with some meat, or we eat it with some fat. And so I like to look more at like the glycemic load, and that's where the plate comes into place, because when you eat balanced, you can have something that has a high glycemic index like white rice or white bread or boiled potatoes. If they're al dente, they're going to be a little lower. Same with al dente pasta, a little undercooked. It's going to take a little bit longer for the sugar to go into the blood. But again, we eat combined. We don't just eat a bowl of rice. Does that make sense?
Yes, thank you. And then, someone's wondering, is there a best time window to eat, like between 9 to 5 or 12 to 8? And, we kind of mentioned that it should be kind of specific to the individual, but if you want to make any comments on the timing.
Yeah, I think the recommendation is to try to eat more of your calories early on in the day. But then again, like the shift workers, they had an erratic schedule and they still had pretty positive results. So ideally, you don't want to have a huge meal right before you go to bed. So I would say if you can, front load, that's always a little bit better, but it depends on what time you go to bed, what time you have your meals. If you're having your meals with your family at 10 o'clock because your kids have sports, then maybe you can't do the morning feeding, because I think it's more important for you to eat with your kids than to stop eating at 4, or at least sit with them. So.
All right, one last question. Do you have any meal service recommendations for diabetes care and prevention?
That's a really good question. I just moved back here from New York, and I'm hearing a lot about a lot of these like HelloFresh and different meal programs. I think the key here is whether you're getting your meals delivered, or you're going out to dinner, or you're preparing your meals, or you're picking up prepared food from like a Whole Foods or Trader Joe's. You really want to try to follow the plate method. So make your choices so that you're getting your protein. It can come from chicken, it can come from fish, it can come from beans, it can come from, tofu, but make sure you have a quarter of your plate with protein and half the plate with vegetables, and then the other quarter of the plate is the carbs. So if you eat in those ratios and that balance, you're gonna really make it easier on yourself and easier on your blood sugars.
Thank you for all that wonderful advice. And lastly, I would just like to share some information that the UC Diabetes Prevention Program has a new program out. If you're pre-diabetic or at risk for developing type 2 diabetes, they have some tools that may help you to gain a healthy lifestyle through education, encouragement, and practical tips for success. So there is an upcoming cohort that is going to begin on June 5th. For more information, please contact Kelly Shedd, and her email is kshedd@hs.uci.edu. This information will be sent to all the registrants in the follow-up email. So thank you for joining us for our Integrative Insider Live community lecture. Upon ending the webinar, a pop-up window will have a valuable survey on this evening's event. Please help us improve our community offerings by letting us know what you think. And we will also be emailing the key takeaways to the email address provided at registration. Our next Integrative Insider Live is scheduled in June. More information will be sent through our Integrative Insider monthly emails and posted on our event page on our website at SSIHI.uci.edu. Thanks again, and we will see you next time.